Sorry I can't be with you in person, but here's my recorded lecture on the critical need for reported guidelines in AI-driven healthcare. And I just want to thank Doctors Cacciamani and Gill for inviting me to give this talk. So let's start at the beginning. Well, hopefully we all do medical research to improve and advance scientific knowledge, and that could be done directly or indirectly, so that we lead to improvements in treatments or prevention of disease, so patients have better outcomes and better quality of life. But to advance that scientific knowledge, we need to do good research, and good research requires a good research question, appropriately designed, well carried out, and importantly, another topic of this talk is that your research is reported in a complete and transparent manner. And how do we do that? Well, that's typically through the scientific manuscript, and that should contain enough information so I as a reader, you as a reader, can fully evaluate or judge the methods or the information that's reported in the article, so we can reach our own conclusions around the faith we have in the findings of the research. Increasingly, readers of scientific manuscripts have more than one audience. We've gone past now clinicians are the only ones reading these papers, but actually other researchers are using them to inform their own research. They may be planning a similar clinical trial, but in their own setting. You have to think also that your research is often the data for another type of research study. So if we want to include your findings in a systematic review, your findings should be thought as data for a different sort of study. So it's important that these things are reported clearly and transparently. Patients and consumers are increasingly using manuscripts to aid their own personal decision making, and policymakers are using this clearly to make policy making decisions. And I've probably missed other types of readership out as well. So we have an obligation as scientists. We should write our manuscripts with enough information that you can come to your own conclusions. And that manuscript is often the only tangible evidence that that study was ever done. So we have a problem with non-reporting of trials, but we also have a problem of trials that are reported but don't tell us all the information. So we need good research, and we need research we can rely on, and that's done through the scientific manuscript. And good reporting is an essential part of doing good research. There's no point designing the best study in the world, carrying it out in a very brilliant manner, and doing really good research if you don't tell us why you did that research, how you did it, and what the results mean. And we're in that phase of importance of open science, reproducibility, and general research integrity, and good reporting fills all of those three components. It's an essential component of all three. So let's come on to reporting guidelines before I move on to AI. So reporting guidelines and reporting is crucial to research. There's Doug Altman. If you've never met Doug Altman, he was one of the guys behind the Consort Statement, been involved in lots of other reporting guidelines. If you've ever used a Blonde-Altman plot, he is the Altman behind the Blonde-Altman, one of the most cited papers in The Lancet. Doug was great for quotes. He passed away a few years ago, but one of his quotes was, to maximise the benefit to society, you need to not just do research, but do it well. That should be obvious, but actually because we know from a growing body of meta-research or research on research that actually a lot of research isn't done well. And that could be poorly designed, poorly carried out, or poorly reported. Another great quote by Doug, and that's very much more in the mode of reporting guidelines, is readers should not have to infer what was probably done, they should be told explicitly. So if I'm reading a paper and a bit of information hasn't been reported, I shouldn't have to guess what was done. I shouldn't have to infer. I can't infer. I need to be told exactly by you as the author. And that's because we know that there is a lot of what we call avoidable research waste. So there's a series of 5 papers published in The Lancet in 2014 looking at trying to increase the value of research and reduce the waste we produce, which is quite considerable and has financial implications as well as safety concerns. So anyway, in this paper 5, which looks at reducing waste from incomplete or unusable reports of biomedical researchers, the authors say inadequate reporting occurs in all types of research. Whether you're doing animal or preclinical, diagnostic, epidemiological, prediction research, etc., there is now overwhelming evidence that there is poor and inadequate reporting across the research landscape. So what can we do to improve that research reporting? Well, we have these things called reporting guidelines. These are checklists typically that are reminders of things you should include, I should include when we are writing up our research. And they are minimum set of information that readers need to judge why your research was done, how it was done, and what the research findings are. Typically they're not requirements. Different journals will have different levels of enforcement. So at the BMJ, for example, if you submit a clinical trial, they will not send your manuscript for peer review unless you have a completed consort checklist. So the consort checklist is for reporting clinical trials. These reporting guidelines are usually, not all the time, but they're usually evidence-based and typically involve an international consensus-based approach with lots of different experts from different fields. So very multidisciplinary, lots of different sorts of researchers, from statisticians, epidemiologists, clinicians, regulators, funders, journal editors, and increasingly patients and the public. And the Equator Network kind of brings all of this together. So it was an initiative that started in 2006 from University of Oxford. We now have 4 other centres around the world that promotes transparent and accurate reporting. And as part of that, we have this library of reporting guidelines for all the main study designs and types in healthcare. And it consists now of over 600 reporting guidelines. What do they look like? So on your left hand side here is the consort statement. So this is an abbreviated version for reporting your abstract. And on your right hand side is the one for the PRISMA statement, which if you've done a systematic review and 40,000 people have cited the latest PRISMA guideline, which is the PRISMA 2020. So if you've done a systematic review, then I'm pretty sure you would have come across PRISMA. Reporting guidelines, these are highly cited, highly used research documents. Journals and publishers are increasingly, or not increasingly, but they've for a while now had them in their instructions to authors. So they point you to specific reporting guidelines, or they point you to the Equator Network to find a guideline for your study design. And funders are now also expecting researchers, when you've got your funded study, you've done it, and you're writing up the report for the funder, they will expect your study increasingly to adhere to a reporting guideline. So that's reporting side. Let's move on to prediction and machine learning. It is a hot topic. I'm stating the obvious here. We're all here at this conference to talk about AI, and it's not the only AI conference in the world. But in the last 5 years, we've seen an absolute ballooning of research done under the guise of machine learning or AI, and that's staggering, the number of publications that we're seeing now annually. And I think this is a rough and ready search in PubMed, and I suspect the numbers are much higher. And we're seeing now a synthesis of prediction model studies, whether you're using regression or machine learning methods. And this is just a snapshot of 50 or so systematic reviews that are looking at synthesizing the quality or the robustness of the reporting, or just trying to decide which prediction model should I use my setting? So I don't expect you to read this, that's not the purpose of this, but it's just to show you the landscape of prediction model studies and the kind of the model mania we're in at the moment. But are these studies reported well? I think it's no surprise that no, they're not, you know, and what we've done in Oxford and with colleagues from UMC Utrecht in the Netherlands is we've carried out a large series of systematic reviews to look at the completeness of reporting, to look at the design, to look at the consequences of poor reporting and poor design on risk of bias. And then we've looked at, well, actually, what have the authors concluded? Have they over-interpreted? Have they spun their research findings? So this is the result of a series of eight studies. My group in Oxford led a series of 4 papers looking at machine learning methods in oncology, and my Dutch colleagues focused on machine learning methods that were published in general medical journals. If we just focus on reporting for the time being, is we went to see how well these these machine learning studies adhere to existing reporting guidelines within the field. So we have this reporting statement called the Tripod Statement, which I led, and we published this back in 2015. So this is pre the current machine learning AI wave of excitement, and we focused on regression methods at the time because these were the prevailing methods being used for clinical prediction purposes. That landscape has changed now, and actually we're seeing probably many more machine learning methods being used. But Tripod, developed for regression, but actually is pretty agnostic to the modelling approach. So if you've done a regression or you've done a random forest, the reporting requirements are pretty much agnostic to those different types. So we looked at whether these machine learning studies were adhering to the Tripod statements. Again, I don't expect you to read the text, that's not the point, but these are the 22 items of the Tripod checklist and whether studies were adhering to each of those items in that checklist. So in an ideal utopia, those bars would all reach 100%. Clearly, they're not. So there is a huge problem with reporting, particularly around model presentation, how to use the model, model performance, the description of the study participants, etc., the sample size, missing data, etc. So there's concerns around things that aren't being reported. And that's just summarising some of the concerns we had when we looked at the reporting. The impact is on risk of bias, so looking at study quality. So this is a risk of bias plot. So I'm sure, hopefully many of you have seen these types of plots. Red means the studies at high risk of bias, green is at low risk of bias, and yellow or that grey is studies that are unclear risk of bias. So when it's unclear risk of bias, that's usually a reporting problem. Clearly we don't want to see red, but actually the avoidable bit is because the authors haven't told us particular details around their study, and this is avoidable. They've done a study, they know what they've done, they just haven't told us. So that's the knock-on effect on risk of bias. Why is risk of bias important? Because we know, yes, this is not new. We've seen a lot of hype around machine learning and AI. Some of it good, but a lot of it is overblown. So we did another review to look at the consequences on risk of bias and claims of performance benefit. On your left hand side, they're the general concerns around we had on reporting, so describing your data, handling of missing data, details on parameter tuning, details on performance evaluation, etc., etc. What does that mean when it comes to risk bias? Well, if you just focus on the top part of this plot for now, so this is a systematic review looking at over 200 studies, look at that compared logistic regression to one or more different types of machine learning method. And if we ignore risk of bias, so we ignore study quality, we ignore reporting, and we just focus on the top line result, and clearly any machine learning method is systematically doing much better than logistic regression. Great. machine learning has benefit. Oh, wait there, let's have a look at whether if we pull out the high risk of bias studies, so the studies that have some methodological concerns or reporting issues, and then we pull out those with no concerns at low risk of bias, do our findings change? Well, yes they do. So if we look at solely at the high risk of bias studies, that pretty much maps onto what we'd look at overall. There's some kind of clear signal that machine learning is doing better, hands down, than logistic regression. That's not telling the full or honest picture. If we pull out just the low risk of bias studies, so the middle part of that panel, middle panel of that plot, actually there's no performance benefit of using logistic regression over any machine learning methods. I think we kind of expect this in noisy healthcare settings. We're not looking at imaging studies here, we're just looking at noisy healthcare settings that are really high noise to signal ratios. But that's all predicated on not having transparency in the methods and knowing what was done. If we didn't know what was done and we just went on the top line headline figure, we ignore risk of bias and ignore reporting, we would falsely conclude that machine learning is hands down beating the more traditional methods. And these findings around reporting have been observed elsewhere. Even in the COVID pandemic, again we saw concerns around risk of bias that were borne out with poor reporting. Open science, we're moving towards open science now. We did a look at whether machine learning studies in the field of oncology, and we had a snapshot of, just took 1 month of publications in a bunch of oncology studies, and whether they were adhering to open science principles and whether they were using reporting guidelines. And the story is quite depressing. That data wasn't being shared, code wasn't being shared or even mentioned in these articles, protocols weren't being used or weren't being mentioned, studies weren't being registered like clinical trials, and reporting guidelines, including the tripod, weren't being used. So what can we do? Let's try to prove things. So we set out to update the original tripod statement, but to include machine learning studies, AI explicitly, and actually harmonise the world. And that's why we have this red plus sign to denote, actually, regardless of the modelling approach, whether you're using regression or machine learning methods, then tripod plus AI is for you. So we followed the traditional guidelines for developing these reporting statement. Lots of experts, 200 around the world, 27 countries, covering 6 continents. We held an online consensus meeting in July 2022 with 28 experts around the world to develop a new checklist that is now agnostic to the type of modelling approach. So if you're using the machine learning method or regression, this is for you. We don't cover though generative AI. And what we're trying to do is harmonise the terminology between regression and machine learning, because they have kind of diverged in places. So we want to improve that, help readers, help the field, and harmonise terminology. So we have a glossary of terms in this paper which is forthcoming in the BMJ. We have a particular emphasis on fairness. That's been borne out in a lot of AI research. We want AI to be fair. Data should be diverse and representative of the target populations in whom we're interested in. We shouldn't be exacerbating existing or creating disparities in healthcare. We want models performed, the performance to be evaluated in subgroups that could be defined by personal or social clinical attributes like sex, gender, ethnicity or race, socioeconomic status, for example, to demonstrate that model is not disproportionately advantaging certain groups. No, we're asking authors to describe the clinical decision that model is intended to support, describing your data, the rationale for using the model, how to use the model, is the model freely available, are there proprietary considerations or concerns. We have a new item around patient and public involvement. These tools are ultimately being used on patients. They should have their say when these things are being developed. We have a new section on open science around data sharing, code sharing, acknowledging this is not a simple area. But we're not the only ones doing AI research reporting. We have the DECIDE reporting guideline, that is looking at early phase studies, so first in humans, looking at the safety profile, human factors or ergonomic evaluation of AI systems. These are early stage steps to doing costly randomized controlled trials. We don't want everything to go through to randomized controlled trial when it's expensive to do so. We want the best studies to go through, and that's predicated on good reporting. And when we do get to that latest interventional phase, then we need guidance on how to report those studies. So the Spirit and AI Consort AI work group has developed extensions to the Spirit checklist and to the Consort checklist to provide guidance tailored towards AI interventions. So if you do the protocol for a randomized controlled trial of an AI intervention, follow the Spirit AI guidelines. Once you've done your trial, write your study findings up to the Consort AI checklist. And we're not the only one doing reporting guidelines. There are others that are tapping into different parts or different types of AI research. So to conclude, there is lots of evidence that AI research is done badly designed, badly conducted, and badly reported. We can only have benefit or trust in AI if the findings are transparently reported. We don't want to cause harm. We don't want to create health disparities or widen existing ones. And reporting guidelines can provide a set of standards on how AI research should be done at various stages in the research pipeline. Thank you very much for listening to me. See you soon.